What is endocrinology and how it differs from physician?
Endocrinology is a level above general physician, so it is super specialty, and he specializes in treating hormones and hormone related problems like diabetes, thyroid, growth, obesity, PCOD, hypogonadism, and osteoporosis. Gonads are testes in males and ovaries in females.
Okay, so how you treat the diabetic patients?
Okay, so this is a very misconception that once somebody develops diabetes, he will develop kidney disease, he will develop nerve problems, he will need to amputate later in life. So one important hormone is insulin. Insulin is produced in the pancreas.
In diabetic foot, basically neuropathy is a biggest complication.
Yes.
As an endocrinologist, how do you manage?
One of the prerequisites to develop diabetic foot is neuropathy.
Okay.
So without neuropathy, it's very unlikely to develop diabetic foot. So diabetes, hypertension, smoking, and the other fourth villain is dyslipidemia, that is bad cholesterol.
Okay.
So intense pain in the calf muscles or thigh muscles, it depends upon where the artery is blocked. So the best thing is to regularly, daily examine the foot. So diabetes control is not only important to prevent diabetic foot, but if diabetic foot is developed, it's also important to prevent infection.
So, sir, when I met diabetic patients and those who are suffering diabetic neuropathy, on that case, many times I tell them to wear diabetic footwear or diabetic socks inside the house, but they do hesitation. So they hesitated to wear it.
Yes.
But why they should wear it, and what is the advantages to wear the socks or diabetic socks or diabetic footwear?
So this is a common sentimental problem that we shouldn't be wearing footwear inside the home. So the whole concept is that people believe that footwear carries all the dust from outside, and how we can wear them in the house. So the answer is simple. You take two pairs, one for outside and one exclusively for the home. And the only place where footwear is prohibited is the puja mandir, and while you are asleep. Okay. The footwear should be right beside your bed, because even home is a place where we cannot ensure that there is no sharp object lying on the floor. There can be nails, there can be bangles, there can be blades, there can be pens.
There can be small stone also.
Stone also.
Yes.
So we cannot be sure. And as I was saying earlier, that even if it pokes, there is no sensation. If it is a small stone also, it can do big damage.
Yes.
So there is no way to bring back the nerves. Dead nerves will not regenerate.
Yes.
At least scientifically. Many people, they do some gimmicks and all online. They sell medicines, but that's not there. Scientifically, dead nerves have some regeneration capacity, but not to the extent of what commonly people believe, that sensations will become completely normal. That's not happening. So what is the next best option? Is to prevent footwear, to prevent foot ulcers or diabetic foot. Yes. Is to have footwear. So this takes a bit of explanation, counseling also, that what we are doing is for your good.
Yes.
Once you develop diabetic foot, the amount of expenses spent for admission, there has to be some other person besides you during that admission, plus a whole lot of pain and all. So you prefer this or that?
You could decide.
Yes, but still many people don't prefer. But we have to do our job.
Yes.
Even if 1 out of 5 people use it, I'm quite happy.
Yes.
Because people also, they see the other person using and they use.
Yes. That's the problem actually. People they only follow. If you tell something, they'll see whether my neighbor is using, my friends are using or not. In my family member, someone is using, someone will tell something. But they should concern about their health, their foot cares. So on the basis of this, they should use it regularly and they'll get relief of that one. Sir, just now you told about the diabetic footwear and diabetic footwear or diabetic socks has to be wear.
Yes.
So, could you tell us what kind of diabetic footwear you should use, and what are the specialties should be there? What kind of things, what kind of footwear, and what are the advantages?
Okay. So, see, our foot, it has forefoot, midfoot, and hindfoot. And it depends upon different patients that they have. Some have pressure over the forefoot, some have pressure over the hindfoot. And in case of Charcot's, where the foot collapses,
Yes.
there will be more pressure over the midfoot.
Midfoot area.
So, footwear should be designed according to the patient's needs. Ideally, footwear should have inner sole, midsole, and outer sole. That you might be aware. So many people, when we say you buy good footwear, they say, we go to this shop, we buy this sponge. The sponge things will not work. The footwear should not be too soft, otherwise it will sink.
Yes.
The inner sole should be soft. The outer sole should be hard.
Yes.
So the foot part that's coming in contact with the ground should not be soft. Otherwise, the purpose of footwear is lost.
Yes.
And there are methods where pressure points are noted and that pressure points are offloaded.
Yes.
So that pressure points are given off. So they no longer serve the purpose of weight bearing.
Yes.
So that is the true sense of offloading.
Yes.
So that is again done by an experienced podiatrist who takes measurements and who sees where the pressure is more and where it's less. So some patients, they go to a podiatrician, some patients they don't have the finances and all to go. So what I say simply for many rural patients who cannot afford to buy expensive footwear is, I say, if there is an ulcer, you buy a thick sole foot and you just take out some material from where the ulcer is.
Okay.
So if the ulcer is at the great toe, I say that you take some rubber out of that or foam out of that. And if you're walking like this, I would say you
Keep your foot like this.
foot flat.
Okay.
You lift your whole foot
Okay.
and then you lay it like this horizontally, not hind foot first and then lifting of the forefoot. So in that way, we can minimize the pressure and distribute the pressure equally over all of the foot.
Because if you'll do some offloading like this, carving something part out of the footwear, it's not going to solve the issues.
Yes.
Until unless properly the weight should be distributed.
Distributed, yes.
Only offload means nothing. If you make a hole, the weight is not distributed. The weight has to be distributed, but at the same time, the weight should not come on the particular areas.
Yes.
That has to be done. So few days before, I met a patient who came with me, with his son, who is a doctor. So what was the condition of the patient was that he was a diabetic previously, and in a day he lukewarm water or a little bit hot water, he keep his foot and under that hot warm water. After 10 to 15 minutes, he saw that his foot is totally burned.
Yes.
So this kind of patient basically comes to you.
Yes, it is quite common to see such patients.
Okay.
I'll give you an example. 44 degrees centigrade, will it burn your feet or not?
44 degrees.
So our body temperature is 37.
37.
Boiling water is 100.
degree. Yes.
I'm saying 44 degrees, will it burn or not? Will it causes burns or not?
No, I don't think so.
So we will have bath with around 60-70 degrees.
Yes.
In winter, we all feel comfortable with.
Yes.
So 44 degrees can also cause burns if we are constantly exposed to it for 6 hours.
6 hours.
6 hours. So if we keep our feet in 44 degrees water,
Okay.
for 6 hours we'll develop burns.
Okay.
Because 44 degrees is more than our body temperature.
Body temperature.
So it will cause burns.
Okay. But the patient, those are diabetic, neuropathy, diabetic, and if they use with hot bath,
Yes.
in that case,
So they have decreased sensation, as I said earlier. So that might not have been lukewarm water. That would have actually been warm water only.
Okay.
Hot water. he felt that it is lukewarm
Okay.
because of decreased sensation. The other many people, they go for pilgrimage without chappals on a hot sunny
Hot.
day. They're quite comfortable walking kilometers on a hot tar road. It's again because they don't experience pain. Heat sensations are lost. They walk for hours together only to next day they realize there are huge blisters,
Yes.
bubbles on the foot. Other common scenario is while sitting behind bike, they
Bike.
sustain silencer injuries.
Yes. Yes.
Yeah, and the other is going to field
Okay.
agricultural
Yes,
purposes.
Yes.
And in North India, it's quite common in winter months to light a fire and sit to put hands and feet there.
Yes.
Used to get many patients, especially in winter months.
Okay. There's a
हाथ पैर सब जल गए,
ulcer
पैर सब जल गए. They didn't notice at all.
due to this
Toes all burnt because of
neuropathy.
absence of sensations. So one thing is, if any diabetic person wants to use hot water, he should call someone and say that whether it is
Check.
actually normal or not,
Okay.
rather than just pouring that water on the foot.
Okay.
I said pain is a gift.
Yes. But it's not there. Those who are suffering with neuropathy,
With neuropathy,
it's very less. Sometimes
it's also common to sustain burns while cooking.
Okay.
So people pick up utensils, they don't have sensations, it burns. So this is very common. People think it should be very foolish for people to get their hands and feet burnt, but this is very common.
Okay. So, what's your advice for neuropathy patients?
So neuropathy patients, they should realize these circumstances. One thing is no barefoot.
Okay.
Barefoot, there's absolutely no to barefoot. And even for agriculture purpose, there is sentiment that we shouldn't be wearing footwear to agriculture purpose. So people should wear shoes, good shoes. And so like these circumstances, while they are going for pilgrimage and all, like hot sunny day, they should not walk barefoot
Yes.
at all.
Yes.
Because even if it's not hot, just the walking itself can cause trauma and blisters
Yes.
that we all commonly experience.
Yes. Yes.
We buy new footwear, it will cause some blisters on foot. So that's also common. And people, while they are sitting behind the bike, they should be aware that there is something known as silencer, and the foot should not be anywhere near the silencer. And people also have this habit of using indoor heaters during winters,
Okay.
especially in North India. People keep their foot there, and in Kashmir, people use kangri, that's a heater they keep
Yes,
below their chair. So even they can develop ulcer over their back, and also this is all there.
And this is, I think, all we have all discussed about the precautions and other things. One question comes to my mind that when a diabetic patient should consult a doctor and how frequently he should consult a doctor.
Yeah, so that depends upon various entities, but ideally, diabetic patient every 3 monthly there should be one doctor visit.
Okay.
If there is a need for earlier visits, like in those with pregnancy and diabetes, small children with diabetes, maybe they are called every month or every monthly twice also. But it again depends upon if somebody has active infection, they should be coming more frequently. But in patients who have very good control, we should see them 3 monthly once.
Okay. Sir, when a diabetic patient comes to you, he's suffering with ulcer, diabetic foot ulcer. So, how do you treat him? What are the treatment procedure you follow?
Yes. So, in a person with diabetic foot ulcer, there are 5 key things that we should look for besides good sugar control. Okay. One is you have to remove the dead tissue. So the tissue that is black, it doesn't have any sensation of pain. It is very foul smelling, that is, it's very bad smelling. It is known as dead skin or dead tissue or avascular tissue. It should be removed. because in the presence of dead tissue, there will not be any new ones.
Okay.
Then you take care of infection. That might be a need for antibiotics. Then you offload the foot. Then the other thing is vascularization. You make sure that the blood supply is restored, if it is possible to restore. So the 5 things are diabetes control.
One is diabetic control.
Control the infection.
Second,
You
infection.
remove the dead tissue
Okay.
and you offload,
Offloading.
and then revascularization. That is provide blood supply.
Surgery is required for that.
Surgery may or may not be required.
Okay.
So if you feel that the ulcer is not healing, then it might be need for revascularization.
So revascularization, in which way you have to do?
So revascularization, it again means that you have to provide blood supply. So people will do stenting sometimes.
Okay.
You might have heard about stenting to the heart and
Yes.
all, but there is stenting to the brain vessels, stenting to many other things that is not many people are aware. So stenting of the peripheral arteries is also there, where they open the arteries.
Okay.
And sometimes people do bypass also on heart,
Okay.
not on heart vessels, but on other limb vessels. So there is also bypass.
It's a kind of surgery.
Surgery only, yes.
Okay.
So that's the way we make sure that, because if you are sure that ulcer is not healing without proper blood supply and there is no other way to create blood supply, then you have to
do surgery.
think of interventional thing.
Sir, when a patient comes to you and the patient is suffering with poor circulations and is not maintaining proper hygiene and there is moisture on the foot, basically on the areas where the two junction point of the two toes. So what's your advice and how should they keep their foot hygienic?
Okay, so they should wash their feet regularly. So there is no particular interval which says that you wash your feet 2 times a day, 3 times. It can depends upon. And people should apply a good moisturizer, and they should not apply to the moisturizer too much, because sometimes they have the problem of slipping. And nails are very important. We want to trim the nails to the very edge. That should not happen.
Okay.
So nails should not be cut curved. They should be cut straight. The edges of the nails, we should not apply a nail clipper.
Nail clipper, okay.
Nail clipper is not there. So the nail clipper has something known as some ridges, where it's there to just grind it. Yeah, that should be used. Not the clipper.
Yes. For grinder, something part is there, so where we have to.
No. On the most nail clippers have, so that there is no need to cut the nail fine.
Okay.
You can cut it and use the grinder to just soften or round it off. So one common problem is that people, in the pursuit of cutting the nail deep, they cut the skin.
Yes.
Then that will be an entry point for all the bacteria.
Yes.
And the skin between the toes, it's often left unattended.
Yes.
So it will be moist, and that's where candida and all will start infection, because candida prefers moist areas, fungal infection. So that's known as candidial intertrigo.
If the foot moisture is present and it's untreated properly, so what kind of infection do people going to face?
So moisture, it macerates the skin. So what happens if somebody washes clothes for 2 hours? The skin is all wrinkled.
Yes.
So typical, it's that washerman's hands.
Yes.
So the same way, if the skin is left like that, suppose we are wet in rain, the shoes are wet, and we come home, the skin is almost like it's not the
Like,
normal skin.
Water
Folds.
uh,
So that skin is more susceptible to breaks.
Okay.
So once it breaks and the patient doesn't have good sugar control, then any sort of bacteria can invade the skin. Typically, bacteria that are on the skin surface, they are normal, non-harmful. But once they get entry into the body and high sugars, they become very harmful. So
Okay.
suddenly the small villain on the skin will become a bad guy
Yes.
inside the body. So skin integrity, maintaining integrity is very important. You make sure that skin is not damaged, then ulcer will also not be there. So ulcer, as I said, just doesn't happen just like that. It takes time. Skin has to be lost to become an ulcer. So if you identify cracks or calluses early, which are pre-ulcerative conditions, then we can prevent ulcers.
Sir, many people comes with diabetic foot issues.
Yes.
So when they're coming the diabetic foot issues, the foot selection is very important. How,
Yes.
what kind of footwear selection and what kind of footwear you should wear, that is very important. So what's your advice on the footwear selection,
Yes.
and how a good footwear will help the patient?
Yes. So, do you know that the foot size changes?
Yes,
Yeah.
we noticed
In the evenings, it is more.
more.
So, people have to buy shoes or whatever footwear in the evening, not in the morning. And we don't want very tight footwear, what's usually sold off as a formal wear for office purpose.
Yes. Hmm.
And all these are all pointed shoes which actually make the toes very crowded.
Yes.
So what happens if you see, if one toe is touching the other toe, the nail of this can actually harm the other toe.
The toes.
And there is hardly any gap between the toes, so all the moisture is there for 8 or 9 hours continuously.
Mhm.
So strictly we should avoid tight shoes.
Okay.
So the pointed shoes are to be avoided, whereas the shoes which have a box shape,
Yes. The broad.
broad,
Yes.
the front part should be broad, not pointed.
Pointed.
So what we say is that after you wear a shoe, there has to be one finger gap between the toe and the footwear. So you should be able to move the toes freely. That sort of footwear should be used, not the tight things. The tight things are very uncomfortable. Although they are very appealing for office purpose, they are to be completely avoided.
Means you have to see the comfort here.
Comfort
rather
first, then cosmetic next.
Cosmetic. Yes. So, and better to go to the footwear shop or somewhere in the evening time.
Evening time.
And third thing is that the footwear, the box should be more wider. Wider footwear
Yes.
should be advisable.
Yes.
And the patient those who are suffering with ulcer or any kind of callus, on that case you should go for a very resilient material, soft material.
Yes.
Inner sole.
So, yes.
Yes, sir. Till it we have discussed so many things about diabetic foot conditions and how we can help the diabetic patients
Yes.
to get after the problem. Sir, tell me few myths and facts about
Okay.
what are the myths are there. People basically think that these are it's not the fact, but in the people's mind, it's there. I should not do this one, rather than they should do that one. It's a what I'll tell. It's a myth,
Yes.
but fact is something different. But they take it as a myth is that I will likely develop diabetes because of my overweight.
Yeah. So it is neither a myth nor a fact.
Okay.
Not all people with who are overweight develop diabetes,
Okay.
and not all people with who are overweight will not develop diabetes. So overweight increases the risk of diabetes.
Okay.
Overweight, it doesn't mean people will develop diabetes. So for the same person, if it decreases weight or becomes in the normal BMI range, chances of developing diabetes will decrease. So lesser the BMI, lesser the chances of developing diabetes.
Okay.
Higher the BMI, higher the chances of developing diabetes at a younger age.
Second myth, I eat a lot of sugar. So I am worried I'll get diabetes. It's myth or
Yeah.
fact?
eating a lot of sugar per se will not cause diabetes. It will cause weight gain and then cause diabetes. But in a patient with already diabetic, eating a lot of sugar can just make diabetes worsen.
Oh, my.
So eating sugar will result in weight gain and that will result in diabetes.
Diabetes. I was told that I have diabetes. I should follow a strict diet.
Yes.
Myth or facts?
It's an absolute fact. There is no denying that. Whether somebody has diabetes or not diabetes, they should follow strict diet. Is it right or not?
Yes, yes.
So if somebody has diabetes, he should not eat sweet. It doesn't mean if he doesn't have diabetes, he can eat lot of
Lot
sweets.
of sweets. No.
That doesn't happen. Nah?
No.
So is junk food, sweets, cold drinks, they're all bad for diabetics, but they're also bad for non-diabetic people.
Okay.
So there is no diabetic diet actually.
Okay.
There is diet for everyone, which is also specially stressed for diabetic people. It's not diabetic diet. There is no diabetic diet.
Okay.
Okay. The half plate should be curries or salad. 1/4 is protein and 1/4 is cereals.
Okay.
So that is the routine diet that we even advise for non-diabetics also.
Okay.
But diabetics in particular should consume carbohydrates which have low glycemic index, complex carbohydrates. So we stress this to diabetic. Doesn't mean we don't advise this for non-diabetic.
It's not safe to exercise with diabetes. Myth or fact?
Yeah, it is safe to exercise. Exercise is a part and parcel of controlling diabetes, and one of the 4 cornerstones or pillars for managing diabetes successfully. But there are some cautions. For example, patients who are on insulin or patients who have underlying heart disease, they should be worried about doing over strenuous exercise, because there can be chances of low sugar during exercise. So if they are doing exercise for more than 15 or 30 minutes, we advise them to take 1 or 2 biscuits. This is
Okay.
not for everyone, but especially for those who are on insulin and who have very good glycemic control. So that such patients tend to have low sugar episodes while exercise. But this should not discourage anyone from going for exercise, because exercise has many other benefits besides sugar control, like decreasing weight, decreasing blood pressure, decreasing lipid levels, and improving stamina, improving balance,
Okay.
decreasing constipation, decreasing dementia, decreasing osteoarthritis, and probably cancer also.
Okay.
So with all these benefits, you are worried about diabetes will be affected by exercise. That's not correct. So
But then that should be proper exercise should be.
yes, on the background of considering the other factors like heart problems and
Yes.
chances of developing low sugar.
I have borderline diabetes. Shall I worry?
Yes, you should be worried. So borderline diabetes patients, 50% will develop diabetes in the next 5 years. So borderline diabetes is not normal.
Okay.
It means the problem has already started.
Okay. So what are the precautions?
So again, diet, exercise, and if somebody is overweight, they should lose like 7% of body weight or 10% of body weight to become normal.
I can stop taking diabetes medicines once my blood sugar is under control.
No, you cannot stop diabetic medications. Probably the dose can be altered a bit, but there is no chance of stopping always. There are some exceptions. People do very strict diet, they lose loss of weight, they lose lot of weight by exercise. Such sort of patients, after consulting their doctor, they can probably stop medicines. But not all patients can stop medicines.
Okay.
So sugars have normalized means that medicines are working. Sugars normalized because of medicine,
Okay.
along with diet, exercise, and so on something. If you stop medicine, the chances of sugar spiking are also high.
Okay.
That's why we don't recommend. We would adjust the dose, but after taking other things also into consideration.
Thank you, sir. Today
Yeah.
we have discussed a lot of things regarding
Thank you. This was very nice.
regarding diabetes and its complications, mainly on diabetic foot. Thank you, and thank you for watching this one. And moreover, what sir told here, kindly, it's a awareness thing. You consider your doctor, nearby doctor, consult them, and according to their advice only, you follow. And thank you, sir. Thank you for
Yeah.
coming
Okay.
for such a busy schedule, and you gave some time for us. And thank you.
Yeah.
We'll meet.
Okay. Right. Namaste.